Have you ever felt anxious about surgery? If you're over 70, it's natural to worry about how your body will handle it. Maybe it's the fear of complications or simply wondering how long the recovery will take. These thoughts are completely understandable, and you're definitely not alone. Surgery at this age is different from when we were younger. Your body heals more slowly, the risks are higher, and recovery can sometimes feel overwhelming. But the good news is, with the right preparation, you can make a huge difference in how you recover. Stay with me as I share 7 crucial tips you can follow before your surgery. These steps are designed to help you heal faster, reduce risks, and give you the confidence to face the procedure with a clear mind. Whether it's a major operation or something more routine, these strategies will help you feel more in control and ready for what comes next. If this is something you can relate to, leave a 1 in the comments and let me know your thoughts. If not, feel free to leave a 0 so I can improve. Now, let's get started with the first tip. 1. Get a full health evaluation. Undergoing surgery after 70 is a different experience than when you were younger. That's why it's so important to get a comprehensive health evaluation. Hospitals will typically check your heart, lungs, and blood work, but there's more to it when it comes to older adults. Aging bodies come with a unique set of complexities, and even minor health concerns can affect how your surgery goes. Things like diabetes, high blood pressure, arthritis, or cognitive changes might not seem urgent but can have a significant impact on how your body reacts to anesthesia and how you recover. Older adults often manage multiple medications, which can interact with anesthesia or increase risks of complications. Supplements, like fish oil or garlic, can also be a hidden danger if not properly monitored before surgery. Additionally, you might not realize it, but nutrition plays a huge role. Sometimes, even when you look well-fed, your body might not be getting what it needs to heal quickly. Malnutrition can slow recovery and increase the chance of infections, making the whole process harder. This is why a geriatric preoperative assessment is so valuable. It's a specialized evaluation that takes into account the unique challenges of aging. It includes a review of your medications, your strength, energy levels, cognitive function, and even fall risk. By doing this, your medical team can plan ahead, making sure you're as prepared as possible for both the surgery and the recovery period. The more they know about your health in advance, the better your chances of a smooth recovery. What do you think about taking extra precautions like this before surgery? Feel free to share your thoughts in the comments. 2. Understand anesthesia risks. When considering surgery as a senior, understanding the potential risks related to anesthesia is critical. For older adults, the body's response to anesthesia is different from when we were younger. One major concern for seniors is postoperative delirium, which can cause confusion, memory issues, and even emotional distress after surgery. It's more common in seniors, especially after major surgeries, and can significantly affect your recovery time and overall well-being. The reason for this is that, as we age, our bodies undergo changes that affect how we metabolize medications, including anesthesia. For instance, our organs, such as the liver and kidneys, might not work as efficiently as they did in our younger years. This can lead to slower processing of anesthetic drugs, which increases the risk of complications like confusion or memory loss after surgery. Some older adults may also experience cognitive dysfunction, which can sometimes last longer, impacting their ability to think clearly and engage in everyday activities. Moreover, seniors often have pre-existing health conditions like diabetes, hypertension, or heart disease. These conditions can alter how your body reacts to anesthesia, making it even more crucial to carefully assess these risks beforehand. Anesthesia can also interact with medications that you're already taking, increasing the chances of complications during or after surgery. So, what can you do to protect yourself? The first step is to have a detailed conversation with your anesthesiologist. It's essential to discuss your medical history, any medications you're taking, and how they might interact with anesthesia. Many seniors find that lighter forms of anesthesia, such as regional anesthesia, are often a safer option compared to general anesthesia, which can have a more significant impact on cognition and recovery. Regional anesthesia involves numbing only a specific area of the body, allowing for less disruption to the brain. Additionally, sedation options may be considered to keep you relaxed without the heavy impact of general anesthesia. Your anesthesiologist can work with you to determine the best option that minimizes risks and ensures your comfort during the procedure. If you're concerned, don't hesitate to ask for a second opinion or seek out more information. Preparing for the effects of anesthesia ahead of time gives you a better chance at a smoother, quicker recovery. By being proactive and understanding these risks, you'll feel more confident when it's time for your surgery and be more prepared to manage any potential challenges. 3. Strengthen your body. Before undergoing surgery, it's crucial to prepare your body to recover faster and avoid complications. This is where prehabilitation comes in. Prehabilitation is all about strengthening your body before surgery to ensure that you are in the best possible shape for the recovery process. For older adults, this is especially important as our bodies tend to heal slower, and we may face more risks of complications like infections or mobility issues after surgery. One of the best ways to prehabilitate your body is through physical therapy. It might sound intimidating, but physical therapy doesn't mean lifting heavy weights or pushing yourself too hard. It's about simple exercises that focus on improving your strength, balance, and endurance. Even light activities like daily walks, stretching, or exercises to improve your range of motion can make a big difference in how well your body responds to surgery. Strengthening your muscles and joints through physical therapy will help reduce the risk of complications, such as infections or muscle weakness, and it can even help you get back on your feet sooner. For instance, if you're facing a knee or hip replacement, strengthening the muscles around the joint can make a huge difference in how quickly you regain mobility after the surgery. Another important aspect of prehabilitation is improving your balance. As we get older, our sense of balance can decrease, which increases the risk of falls. Pre-surgery exercises that focus on balance can help you feel steadier on your feet, which is essential for your recovery. Being physically prepared also helps your body tolerate the physical stress of surgery and the recovery process, reducing the time spent in the hospital and the need for extended care afterward. Even if you're not able to commit to a full physical therapy program, simply adding more movement into your daily routine, whether it's walking around your house or doing gentle stretching, can help. If you're unsure where to start, talk to your doctor or physical therapist for personalized recommendations that suit your needs. The bottom line is that by getting your body in better shape before surgery, you'll set yourself up for a smoother recovery, fewer complications, and a quicker return to your regular activities. Your body can handle surgery much better when it's strong and prepared. 4. Review and adjust medications. Before surgery, one of the most important steps is to review and adjust your medications. Many seniors are on multiple medications for various conditions, and some of these might interfere with the surgery itself or the recovery process. It's essential to have an open conversation with your doctor about all the medications you are taking, prescription, over-the-counter, and even herbal supplements. Certain medications, especially blood thinners, can increase the risk of bleeding during surgery. If you're taking medications like aspirin, warfarin, or other anticoagulants, your doctor might recommend stopping them for a short time before surgery to minimize this risk. Additionally, some medications can interact with anesthesia, potentially leading to complications like confusion or delirium after surgery, which is a common concern for older adults. Even some common over-the-counter drugs, like pain relievers or supplements such as fish oil or garlic, can affect the surgery in unexpected ways. These could interact with anesthesia or affect your recovery by increasing the risk of infection or slowing down the healing process. Be sure to discuss everything, including supplements you might think are harmless, with your doctor to ensure they don't interfere with your procedure. Your doctor might also need to adjust doses of certain medications that you take regularly. For example, if you have high blood pressure or diabetes, it's essential to ensure that your medications are well balanced before surgery to keep these conditions under control. Blood sugar or blood pressure fluctuations during surgery can increase the risk of complications. Don't hesitate to bring up any concerns you have about your medications. Your doctor will appreciate knowing exactly what you're taking, and together, you can ensure that everything is optimized for your health and safety during the surgery. The key is to follow your doctor's advice carefully regarding your medications before and after surgery, and never stop taking any prescribed medications without consulting them first. 5. Plan for your recovery. Having a clear plan in place for your recovery is crucial for a smooth transition after surgery. It's easy to focus solely on the surgery itself, but recovery is where a lot of people face challenges. It's important to set realistic expectations for how long it will take to heal and what kind of support you will need during this time. The first thing to consider is whether you'll need assistance at home after the procedure. Many seniors might feel fine right after surgery, but soon realize they struggle with basic tasks like dressing, cooking, or getting around. It's wise to have someone in place to help with these things. Whether it's a family member, a close friend, or even a professional caregiver, this support can make a huge difference in your recovery time and overall well-being. Another consideration is whether you'll need any home healthcare services. Some people might require physical therapy or wound care at home, especially if surgery involves a major joint like the hip or knee. Discuss this with your doctor to understand what type of follow-up care you will need and whether home visits from a healthcare professional might be required. You should also think about how you'll manage pain during your recovery. After surgery, pain management is a big part of the healing process, and your doctor will likely prescribe medication to help you with this. However, it's essential to discuss alternative methods as well, such as ice packs, physical therapy, or gentle exercises that can help you stay comfortable without relying solely on medication. If you live alone, consider making arrangements for additional support, at least in the initial days after your surgery. Whether it's a trusted neighbor, friend, or hired help, having someone nearby can give you peace of mind and reduce the risks of accidents, like falls, during recovery. Lastly, try not to rush the process. Recovery can take time, especially as we age, and it's important to listen to your body. Set small goals for yourself and celebrate each milestone, whether it's walking a little further each day or gradually being able to do more tasks on your own. Planning ahead and arranging for the right kind of support will make your recovery much easier and less stressful. 6. Watch out for hidden risks. As we age, our bodies become more vulnerable to certain health risks, especially during recovery after surgery. One of the most common, yet often overlooked, risks for older adults is infection. Our immune systems naturally weaken with age, making it harder to fight off bacteria and viruses. This means that any small wound or incision could become an infection if not properly cared for. For this reason, it's essential to be vigilant about signs of infection, which can include increased redness, swelling, or warmth around the surgical site, as well as fever or unusual pain. If you notice any of these symptoms, it's crucial to contact your healthcare provider right away. Early treatment can prevent infections from becoming serious. Another risk is the development of bed sores, also known as pressure ulcers. These are areas of damaged skin and tissue that occur when someone remains in one position for too long. Older adults, especially those with limited mobility, are at higher risk for developing bed sores. To prevent them, try to stay as mobile as possible, even if it's just getting out of bed for short walks or shifting your position regularly. Your healthcare team will help you with guidance on how to move safely during your recovery. Aside from infections and bed sores, there are other hidden risks that can affect your recovery. For instance, blood clots are a concern after surgery, particularly in the legs. It's important to follow your doctor's advice on mobility and exercises that can help prevent blood clots from forming. Compression stockings or anticoagulant medications may also be part of your post-surgery plan. Proper hygiene also plays a big role in reducing these risks. Make sure to wash your hands regularly, keep your surgical site clean, and follow any specific instructions your doctor gives you for wound care. It's also important to stay hydrated, eat a nutritious diet, and get enough rest, as these factors help strengthen your body's ability to fight off infections and heal more quickly. By staying proactive and aware of these potential risks, you can reduce the chances of complications and make your recovery process smoother. 7. Prepare mentally and emotionally. When preparing for surgery, we often focus on the physical aspects, the tests, the treatments, the medications, and the recovery process. But just as important and often overlooked is the mental and emotional preparation. Surgery can be a stressful and even frightening experience, especially as we get older. It's natural to feel anxious, uncertain, or even overwhelmed by the thought of it. One of the key things to remember is that these feelings are completely normal. Many people, no matter their age, experience anxiety about surgery. The uncertainty of the procedure, the risks involved, and the recovery process can bring up a range of emotions. That's why it's important to be open about how you're feeling with those around you, whether it's family, friends, or your doctors. Having a support system in place is essential for emotional well-being during this time. Talking to your family members and loved ones can help reassure you. Sometimes, just knowing that someone will be there to help after surgery, or simply to talk to, can make a huge difference in how you feel. Don't hesitate to reach out to your support network. They can also help you with daily tasks during your recovery, which can take a load off your shoulders. Another useful step is to consider joining a support group, either in person or online, for individuals who are facing similar surgeries. Many people in these groups have been through what you're about to experience and can offer advice, share their own stories, and provide emotional comfort. Sometimes, just knowing you're not alone in this journey can make the experience feel less daunting. If you find that your anxiety or fear is overwhelming, it might be helpful to talk to a counselor or therapist. Cognitive behavioral therapy, CBT, for example, can be effective in managing pre-surgery stress and can help you approach the situation with a more positive, calm mindset. Many hospitals even offer pre-surgery counseling or emotional support services to help you navigate your feelings. Remember, your emotional health is just as important as your physical health when it comes to a successful recovery. By taking the time to prepare mentally, you'll be better equipped to handle the stress, recover more quickly, and make the entire surgical process smoother. Surgery is a significant event at any age, but when you're over 70, it requires special attention and preparation. It's not just about getting through the operation, but ensuring you have the best possible chance for a smooth recovery and long-term well-being. By taking the right steps beforehand, getting a thorough health evaluation, understanding the risks of anesthesia, strengthening your body through prehabilitation, reviewing your medications, and preparing emotionally, you can significantly reduce complications and increase your chances of a successful recovery. Remember, your health and quality of life are worth the effort. It's about being proactive, not reactive, when it comes to surgery. You deserve to feel confident and in control every step of the way, so don't hesitate to ask your doctor the tough questions. Seek help when needed, and take the time to take care of yourself. If you're about to undergo surgery, don't let the uncertainty overwhelm you. Equip yourself with the knowledge and support that will help you face the challenges ahead with strength and courage. If you found this video helpful, please give it a thumbs up, leave a comment below, and share it with others who might benefit from these tips. And if you haven't already, make sure to subscribe to stay updated with more advice to help you navigate your health and well-being as you age. Take control of your journey today. Let me know how you're feeling about your own surgery preparations, or if you have any questions. I'm here to help.